Now, Portlaoise will be the Midlands hospital most severely affected by potential staff shortages on July 11th, and some believe a downgrade of the facility is impending already and that various departments will close. If that comes to pass, let's explore how it will affect people depending on the hospital. Grainne Boland from Mountmellick is a support worker at the hospital and coordinator of the Save Portlaoise Hospital Action Group. Eileen Byrne, also a member of the group, is a patient at the hospital, and Adam Haughton is also a member of the Save Portlaoise Hospital Group. Guys, you're very welcome to the programme and thanks for joining us.
Thank you for having us.
Now, you've heard a very active group in Roscommon, very passionate about saving their local hospital. Have people in Portlaoise mobilised to the same extent, Grainne?
They have. We actually have a couple of groups up and running. Our group is called, as you've said, Save Portlaoise Hospital Group. We started off with a Facebook page, which we've had phenomenal response to. As of this morning, in 5 days it's been up and running. We have over 2,000 friends now. We're getting great support, great comments through that Facebook page. A lot of the public is willing to come out and help us, stand behind us and support us. That's what we're here today to ask for people from the public. It doesn't matter what area you live in or what area you work in. We want everybody to come out and stand behind us and support, stand shoulder to shoulder and stand up to the government and fight for a hospital and keep our services in Portlaoise.
And what is it that you're all afraid of?
Well, myself as a parent and as a single parent, I have children. I use the hospital regularly myself as a patient and my children. I have friends and family members that are also sick and use the hospital as well. So as part of my community, as part of my residents association as well, we just want to get out and stand up and start screaming and shouting that we will not stand for this anymore. You know, as a resident of Ireland, as a citizen of Ireland, we're entitled to a proper health care. We should get a proper health care. We pay enough taxes. Why aren't we getting a proper health care? We should save the services. We need these services. People's lives depend on these services.
We're told that what is happening on July 11th, the rotating of posts, that it's more or less an unfortunate sequence of events leading to a shortfall in staff and that it's a temporary situation. Do you accept that?
No.
We don't accept it, and what we're afraid of and is what's happened in other hospitals, and other members of hospitals and other staff members from other hospitals have spoke to us. In other hospitals, areas have shut down temporarily and have never reopened, and that's what we're afraid of at Portlaoise Hospital as well.
Ellen, a little bit about yourself if you wouldn't mind.
Well, I have a lot of illness and some of them are quite serious, like I have heart problems. I have problems with my breathing. I'm diabetic. I have high blood pressure. I have COPD. I have CAD, which is coronary artery disease. I also have a valve that's not right in the left side of my lung. And the COPD is a chronic obstructive pulmonary disease.
I've never heard of it, but it sounds nasty.
It is. It's my own fault. You can get it from smoking and all that. But if I take an attack, I need oxygen and I need it fast. It's just like the heart. If I take an attack, I need to get to the hospital fast.
Well, it sounds like you've been through the wars, to use that expression, with your health.
I know nearly every one of the doctors, and I trust every one of the doctors in that hospital and the workers and all. I trust every one of them.
How often would you have to visit the hospital? Well,
up to Christmas I was going every 3 weeks. I was in the hospital. I would be in accident and emergency every 3 weeks. I would be in the day ward. Yeah, needing oxygen and other things that was going on. You know that way? I would be in the day ward because they'd be doing tests to find out what was wrong, you know that way. Then I'd be brought into the actual hospital. I'd be in there for about a week or 2 weeks, you know that way. And as I progress and I get older, that's going to get worse. So I'm going to need it. So there's going to come a time when I definitely need a hospital and I won't be able to wait or make it to Tullamore Hospital.
Well, even in the run-up to Christmas, when the staff shortage wasn't as much of an issue as it would be in 13 days' time, how long did you have to wait in A&E before you were attended to?
Probably about a half an hour at the most.
So not too bad at half an hour?
No, it wasn't too bad. because they could see I was sick, like.
Yeah, so you would have been a priority patient.
Yeah, priority.
And would have been top of the list. But if you had to travel to Tullamore, first of all, you would have the journey itself, which would be half an hour maybe in an ambulance?
Added on to it, 40 minutes to get there from where I live.
Especially if there's traffic and other obstructions on the road.
Exactly, yeah.
And what could happen if you had to wait 40 minutes for oxygen?
I could die. I mean, I've often arrived in Portlaoise Hospital with no oxygen in my body. And I was actually arrived in Portlaoise Hospital with that from my own doctor's surgery. So if I'd have gone to Tullamore, I'd have come back out in a brown box. It was as simple as that. I had to be there and get the oxygen when I needed it.
What does your doctor say about the prospects then of you not having access to oxygen very quickly?
Well, I haven't actually spoken to him, to be honest with you, but I don't think he's very happy.
I can't imagine. And it's obviously something that worries you.
My own GP, which is a brilliant GP, he was actually trained over in the Portlaoise Hospital. So, he is the best as well. So I'm very lucky like that.
Adam Haughton, what's your perspective on this?
Well, if I can just comment, just the clip that you played from the outset, it was interesting. Our group, as I said, intends in the near future to follow suit. We intend to be very visible and very vocal in relation to this. We believe that the time for talking is long past. We need to get out onto the streets, It was interesting, as I say, the education. There was people protesting outside the door there for an education for their children that need special needs. The senior citizens had to do it, and now it looks like the people of this county are going to have to follow suit. We need to get out onto the streets, and as I say, we are going to become very visible and very vocal in the weeks ahead. In addition to that, I'd like to say that whatever group is out there, and in particular the meeting that's been held Wednesday night, we are fully supportive of any group that's out there campaigning to save Portlaoise Hospital. We will row in with any activity they're engaged in, and likewise we hope that they will support any of our activities.
Yes. There seems to be another group known as the Hospital Action Committee, and they have organised for tomorrow night at 8 in the GAA Club in Portlaoise a public meeting to discuss their particular fears. I want to come back and explore this in just a moment. We have to take a quick break and we have to try and give away some money here on Midlands 103, perhaps €18,500 after these. We're discussing the future of hospitals here in the Midlands, particularly Portlaoise, and we have a number of members of the Save Portlaoise Hospital Action Group in studio. They are Grainne Boland, Eileen Byrne and Adam Haughton. And they all represent their various residents' associations as well, and they're trying to mobilise and gather support and, I suppose, raise awareness of their concerns. Now, Ellen, are there signals or indicators that you've picked up on that would cause alarm about the future of the hospital?
Yeah, as I said, I was getting a test done, and they decided that they were going to send me up to Dublin. And I couldn't understand why they wanted me to go to Dublin when they had the facilities down in Portlaoise to do the test down there. And they said,
it wasn't a highly specialised test that you had to go to Dublin for. This could have been done locally.
Oh yeah, it could have been done in Portlaoise. And the heart cardiologist down there is an excellent cardiologist, Dr. Fleming, that way. So he is one of the best, and he's in Portlaoise.
And were you given any explanation as to why you were sent to Dublin?
They said that if I was up in Dublin and they would have to redo the test again and then do something about it. But as I said, why can't they do it down in Portlaoise when they have all the equipment and they had the doctors? And that's all that was said to me.
And Grainne, you're a little bit concerned about the long period this summer during which elective procedures won't be carried out.
Yes, as I'm sure you've all read, we put a link up on our Facebook page, Save Portlaoise Hospital Facebook page, last night. Our secretary, Tammy Mangan, linked it up onto it, where it has said that from the 4th of July to the 2nd of September, they are actually closing the day ward and the outpatients department, bar maternity, obviously, clinics, the antenatal clinics and the warfarin clinics. And no elective surgery will be done either unless it's an emergency. What we're afraid of and what's happened in other hospitals is that if these close down and if these stop for the summer, will they guarantee that they will reopen again in September? And what about the patients that are waiting on these surgeries or these appointments? How far back is this going to push the waiting list, for the patients and for the people of Laois?
The HSE contends that this can happen every year to allow staff to take holidays, to cover various types of leave, and that it is only a temporary measure. But your argument is that the period for which these services won't be running is longer this year than in previous years.
Yeah, this is the longest we've ever had it. Normally a week or two at the max, maybe a week or two at Christmas. But it's very concerning. It really, really is very concerning. It's never been this length before. Never been this length before.
And Grainne and I were talking to this gentleman when we were out canvassing, getting signatures. And he was saying that he has a heart problem. And whatever kind of a problem it is, he has to get to a hospital when he takes an attack within a half an hour to get an injection. And he said there is no way that he's going to make it to Tullamore to get that injection. So they're actually signing his death warrant. And this man was absolutely really worried about it. And he was genuine about it and genuinely upset.
And is that the feeling you're picking up from a lot of people, all of you, through going around and
people
canvassing?
Are attending at the hospital. Like when I was going around door to doors on Sunday, I met people that were really upset about it,
And is there anything that could lift that anxiety?
Well, that's what I'm saying. What's often been said here, there is an onus on the HSE and the Minister, indeed the Minister O'Reilly, to lift this anxiety and this uncertainty, because there's people, as I say, just as been outlined here, they're at home as we speak and they're full of anxiety. They need the situation to be clarified by the HSE and the Minister. Otherwise, people are going to be suffering and people are going to be very concerned. And we would ask, as a matter of urgency, that situation is clarified, because rumour and speculation is rife out there. Nobody knows exactly what's happening, the future of the hospital. And at least if that can be clarified, it would put people at ease. That like Helen there.
Yeah.
Government ministers are going around declaring that we have lost our economic sovereignty, that they are in a straitjacket when it comes to spending, and that, we're borrowing €300 million every week just to keep the show on the road. In view of that, there has to be a cut here and there, and inevitably in health as well as other services. Do you accept that?
Well, they're political choices. The reality is that is a political choice. The political choice to pump billions of euros into the banks was a political choice. We're saying, when it comes to health, when it comes to education, that's a political choice. We don't accept it. You don't cut back on people's welfare and their health. As I said, the education is the same situation. We're talking about political choices here. And I do appreciate and understand the situation the country is in. You've mentioned it, we have almost lost our economic sovereignty.
Will, when they were out at the doors, banging down our doors, begging us for their votes, promising us the sun, moon and stars, promising us that they will not cut frontline services.
Did this come up on the doorstep back in February?
Yes, it did. And especially for anyone that knocked with me working in the HSE, we were worried about the state of the HSE. We were worried about all the cutbacks and the pressure it's putting on us as staff. It was just shocking, but I just can't get over all the false promises that they've promised us at the doorsteps to get their votes. And now 3 months into it, and the first thing they're doing is cutting frontline services. It just doesn't make any sense. And I know that cuts have to come across the board. But, listening to your radio show all week, Will, you've said you've had the figures, you've said the numbers. Portlaoise have huge numbers coming through their door every day, every week, every month. Our numbers are bigger than Naas, Mullingar and Tullamore. We have a huge catchment area. It just doesn't make sense to really curtail Portlaoise services. People are going to suffer.
And that's your bottom line.
Yes.
You don't want any curtailment in services. You're not prepared to compromise on any measure with the HSE.
No, we don't feel we should have to. The pensioners got out last year. They got out March shoulder to shoulder, and it was the only thing that the government backtracked on. And I think the people of the Midlands have to get out and do the same. Show what we mean. Show what we can do. It's the only way. The people is the only way that we can show the government what we mean.
And just in addition, our public representatives have a huge responsibility here, and we will be in the coming days as part of our petition. We will be asking every town councillor and every county councillor and every TD to sign up to this position. They need to state what their position is in relation to this situation going forward, because as Grainne said, on the doorsteps during the election, we were getting a very straightforward message that, you know, there will be no cut to frontline services. We need now these politicians and reps to now come out and support our campaign and whatever other campaign is going out there and about to save Portlaoise Hospital. Yeah.
I suppose really the only public reps who can effect any change are those who are in government in the Oireachtas. Councillors no longer sit on health boards. Yeah. So it is a political decision at the very highest level. What is Charlie Flanagan saying to you? What's John Whelan saying to you? They're the local Oireachtas members in Portlaoise. Have they said anything?
Well, we have Facebooked them, and we've tried to contact them. At the moment, we are still in the process. We have managed to get through to a couple of county councillors and town councillors as well. You know,
I know Brian Stanley of Sinn Féin has been very vocal in his support for the hospital, but he's in opposition. He's in opposition,
and he has. And we're actually waiting on a few of them to come back to us. I'm sure everybody's very busy at the moment. I know myself, working in Portlaoise Hospital, our union representative there's meetings going on as well, and as far as I know, there is a meeting planned with Charlie Flanagan. They've already had a meeting with Brian Stanley, and there was letters sent out inviting all the TDs and local government officials to come forward and talk to us and discuss with us what is going on. As you said, nobody is saying anything. They're not ruling out anything, but they're not saying anything either.
This Hospital Action Committee is organising the meeting, just to repeat, tomorrow evening, 8 p.m, GAA Club in Portlaoise, to discuss their stance. And I take it there aren't too many groups. There's your group, there's this one. It's not a splintered movement, is it?
No. There's actually I think there's another 2 or 3 groups all together.
And can you come together under one umbrella?
Yeah, I mean we're all together. The more groups that's out there, the better. You know, the more areas that'll be covered. You know, the more agendas that'll be covered. We're all for it. As many as they want, get out. We're asking for people to come and support us. You can find us on Facebook. You can email us on saveportlaoisehospital@gmail.com. You can contact myself or Adam. Our numbers will be in the newspapers this week. And we're also out petitioning with members of the hospital, and we have petitions. We have thousands coming in at the moment, and we still have thousands of sheets out there being filled. And we'd like to ask people who are out there, whether you see us at Dunstores, whether you see us outside the Mass, whether you see us in Tesco's, we're out door to door. It really is starting to pick up. Please sign the petition. All we need is a signature and a name. That's all we ask for.